Now, from the News Channel 5 network, this is Medical Mondays.
Good evening, everyone. Welcome to Medical Monday. I'm Carrie Sharp. So glad you're joining us tonight. We have another great topic for you, especially if you have anything going wrong from your fingertip to your shoulder. I got the guy for you tonight, and of course, we are welcoming your phone calls. We'll get that number up in just a second. Dr. Jason Haslam is joining us, an orthopedic surgeon. Thank you so much for being in here.
Thank you.
You see patients all over Middle Tennessee because you have several different offices. Where are you set up?
Well, I have my main office is in Nashville. It's very close to Centennial Medical Center. And then I also have an office in Clarksville and an office in Dixon where I see patients.
And it's called the Haslam Hand Care Center?
That is correct, the Hand Care Center. We've changed the name to Ally Orthopedics because we now do all kinds of orthopedic surgery from fingertips to the tips of the toes. So it's Ally Orthopedics in Nashville, Performance Orthopedics in Clarksville, and in Dixon, it's Dixon Orthopedics and Sports Medicine.
But don't get confused by all those names, because we're going to give you a phone number throughout the show that if you're interested in seeing Dr. Haslam, you can call, set up an appointment that way. So just have that notebook handy and a pen or paper handy or pen or pencil handy, and we'll get you that number. You do cover a lot of ground when it comes to the body and surgeries and things going wrong. What are the most common things you see?
Well, my fellowship training is upper extremity surgery, so I see a lot of hand, wrist, elbow, and shoulder injuries. And so I would say the majority of my practice is related to those areas of the body. Yeah.
And there's a lot to go wrong here, you know. I mean, and I was reading some of the material. Some of it can be genetic, some of it can be from overuse or a traumatic injury. Anything stick out to you that you see a lot of complaints about? Well,
I would say probably the #1 complaint I see in my office is related to a common diagnosis called carpal tunnel syndrome. And it is ubiquitous, and I have a lot of patients that have a lot of trouble with it. And so I see patients quite frequently for that particular problem.
I've heard lots of people just in the work setting complain about it, or they say, you know, I spend all day typing. What is carpal tunnel? What causes it? And then what do you do about it?
Well, carpal tunnel syndrome is a nerve-related problem, and what happens is there's a structure in the wrist area called the carpal tunnel, and there's a big nerve, and that nerve is called the median nerve. It's being entrapped in that tunnel. And when that nerve sees just a little bit too much pressure, it starts to give you lots of symptoms of numbness and tingling and pain. It can give all the sensations of a normal nerve when it's irritated. It can be burning or aching sensation, and it can be quite debilitating for patients, very painful. And so it's just related to a nerve compression problem in the wrist area.
So what do you do?
Well, there's several things you can do. As a, you know, we try not to do surgery right away. We try to get these things better without doing something operative. But frequently what we'll end up doing is a non-surgical intervention, conservative treatment. Typically we'll start off with things like wearing a wrist brace, for example. That positions the wrist in a good position for the carpal tunnel. If that's not working, then we'll sometimes inject a little bit of cortisone around that nerve in that tunnel, and sometimes that will decrease the inflammation. Sometimes if that's not working, we'll even do modalities such as physical therapy. Anti-inflammatories can sometimes be helpful for it. And when all else fails, then we sometimes resort to a surgical intervention for it.
And the rehab along with that is a couple of weeks, right?
Yeah, absolutely. Now the procedures have gotten a little less invasive. And so if you do a minimally invasive procedure, for example, what's called an endoscopic carpal tunnel release, I'm pretty liberal with what my patients do afterwards. I usually tell them if it hurts, stop doing it, but otherwise it's okay to start moving it. So I try to encourage movement of the fingers so things don't get too stiff afterwards. So I'm pretty aggressive about trying to get patients moving their hands relatively early.
I'm sure we'll get more calls about this, and by the way, we do have some calls. I want to encourage you to call in if you have a question for Dr. Haslam. The number is on the screen, 615-737+. As always, we will get to just as many calls as we can, so let's get started. We have Noel on the line. Good evening. Thanks for being part of the show. Go ahead with your question.
Hey, good afternoon, Dr. Haslam. I am experiencing some numbness and tingling in my thumb and forefinger and middle finger of my left hand, and I am severely left-handed. Is that carpal tunnel? Is that something that can be used? I'm on the computer all day, every day, so.
Yeah, that's a very common complaint associated with carpal tunnel syndrome. If I looked in the textbook at carpal tunnel syndrome, your picture would probably show up. It turns out that that distribution that you're describing, the thumb, index, and long finger, is the distribution of the median nerve. and that is the nerve that's traveling in the carpal tunnel. So when patients come to me and say, this is where I'm having numbness and tingling, that's classic for carpal tunnel syndrome. So that's probably what you have. And do you have symptoms at nighttime? Do you feel it at nighttime also?
Yeah, a lot of aching and pain at night.
Yeah, that's
for a long day.
Yeah, those are kind of classic symptoms of carpal tunnel syndrome. It can be very painful, and it also can affect the way your hand functions. Many patients will even drop things because the hand will become weaker because of the injury to the nerve. So yeah.
What should she do? Yeah, what can she do?
Well, one of the common treatments, as we mentioned before, is to try a wrist brace, and that wrist brace again is designed to put that tunnel in a good position to allow the nerve to have just a little bit more room. And so frequently what we'll do is we'll start you off by getting you a wrist brace. It's called a cock-up wrist brace.
It's not something you're going to go down to your drugstore and get and just say,
you actually can.
Really?
Yeah. Those drugstore braces are in a very similar shape as what we have in our office, and so it's okay to start off with something like that. And then of course when that's not working, then we start talking about using perhaps like a cortisone injection in the area of the carpal tunnel. And again, sometimes that works and sometimes it just doesn't work, and patients will come back with what we call breakthrough pain, and then we start talking about doing something surgical if necessary. So. Okay,
very good. Good luck to you. Let's go to Darla. Darla, good evening to you. What's your question?
Evening. I'm somewhat accident prone, so I don't generally pay attention to the little bumps and scrapes and things unless I absolutely have to. And what happened recently, I'll preface this by saying that two things: that I've already got an appointment with my primary care physician, and I will likely be referred, and I'm thinking maybe for x-rays, and that I have Googled some information about it, but I know about reputable medical sites and those that aren't, and that you can, there's a range of things that any one symptom could mean, so I've got all of that in mind, and I actually broke or sprained a finger at one point, so I kind of dismissed this because as I vaguely remember injuring my finger, but it's not really, I couldn't tell you exactly when or what, under what circumstances, but what forced me to pay attention is what formed. I thought it was just that I sprained this finger. It wasn't the same finger as before. That it either sprained it or broke it, and it just wasn't healing correctly because in my knuckle there's a big bump there. But I've since learned that it could be anything from this disease that starts with a D that you're probably familiar with to any number of things. And so I'm definitely going to do something about it. But I just wanted to give me kind of an idea. In that instance, they said basically where it was this kind of like the worst case scenario is that you have pain when you bend your fingers and so forth. There is absolutely no pain.
Yeah, it's really difficult to know for sure, but I can tell you most of the time if there's a lump or bump on your finger, if it's around the joint, it can be several things that it could be. You're referring to a word, this D word, it's called a Dupuytren's contracture, which is a hand ailment where the finger develops these little lumps and bumps, and it also brings the finger down into a contracture. It really can cause a lot of problems. But you described that you're not having a lot of pain, and it's possible that this lump or bump could be what's called a ganglion cyst. That's a very common finding. What that is a little bit of joint fluid, which actually gets outside of the joint and forms a small bubble. They're benign. It's not like it's a cancer or anything like that, but they can take up some space, and they can be uncomfortable for many patients. But for many, it doesn't bother them in terms of pain, but they can see it, they notice it. And
is it something you drain if it is bothersome, or what happens?
Exactly. There's several ways that you can get rid of it. Sometimes they'll just go away on their own, so it's okay just to watch it. And then if it's bothersome for patients, we sometimes either drain it or we put a little bit of cortisone and numbing medicine in it, and then that sometimes will pop it, and that will sometimes get rid of it. Sometimes it doesn't go away and patients want to get rid of it from a surgical standpoint. We just remove it that way.
Gotcha.
So it's a small outpatient procedure, but sometimes these lumps or bumps are common to see around the finger. It could be an arthritic nodule, and so sometimes a little bit of arthritis will form these nodules.
Okay.
Yeah.
All right, great questions already. If you have a question for Dr. Haslam, we're going to take a quick break. We'll go ahead and get you lined up, so be watching. We'll be right back.